flocks of birds, and then we also have a pigeon pox vaccine. And whether you use one vaccine or the other really depends on the situation that you have in hand. If fowl pox is endemic in the area where your flock is, you're going to want to use the fowl pox vaccine. If it's not endemic in that area, you could successfully use the pigeon pox vaccine. And again, the difference between those two vaccines, they both are protective, but pigeon pox is a more mild vaccine. Next, we'll cover neurotropic diseases. This is primarily avian encephalomyelitis. It's caused by avian encephalomyelitis virus, or AEV. In young chickens, AEV can cause paralysis, ataxia, and muscular dystrophy. In older birds, we generally don't see any involvement of the central nervous system, but what we observe is a decline in egg production and hatchability. So in the egg layer birds, this egg production is going to drop for about 2 weeks, but it will return to normal. This costs a lot of money, of course, for the egg producers, because that drop in egg production can be, anywhere from 20 to 40%. This is primarily a disease of chickens, but the isolation of AEV has also been isolated from turkeys, pigeons, pheasants, and quail. This virus is a member of the Picornaviridae family in the genus Tremovirus, and that Tremovirus is indicative of the tremors that it causes in those younger chickens. These viruses are non-enveloped, a single-stranded positive sense RNA viruses, and they're transmitted both horizontally and vertically. And we do have two pathotypes of disease. There is an enteric pathotype, so the virus replicates in the GI tract. With that, you don't observe any of the tremors or central nervous system signs. And then we also have the neurotropic, and of course, as the name would suggest, that type of disease, we do see the tremors. To diagnose AEV, you would want to collect the brain for a neurotropic case, or the pancreas and duodenum for an enteric case. And those tissues would be submitted for histopathology. And you can also do virus isolation, but once you identify that you have this virus in the tissues, there's really not an added benefit to virus isolation. And we control AEV through vaccination. So for our birds that are longer lived, like our egg layers or broiler breeders, they're all vaccinated for AEV. Here we have some images. Bird on the left here is sitting back on its hocks. It's unable to move, and then the birds on the right are actually alive, but they are paralyzed. AEV can also cause cataracts in birds that survive the acute infection. Here on the left, you can see some lens opacity in this pheasant. And over here, there's a little pale blue area of opacity as well. Next, we'll talk about a group of viruses that cause enteric disease in poultry. These are the most difficult diseases to control and really to identify. We don't have any commercially available vaccines to treat enteric viral diseases in poultry. And it can be really difficult to identify the etiology in an enteric disease. So when we look at the list of viruses that come up in our investigations of enteric disease, we see reovirus, rotavirus, adenovirus, and coronavirus. And then we see this list of viruses that I've highlighted here, and we call those small round viruses. And they're called small round viruses because that's how they look under the electron microscope. They don't have many surface features that will distinguish one from the other. And so discrimination of these viruses from one another is generally done based on size. If you look at the image on the right, have a really nice compilation put together by some colleagues at UC Davis. You can see here that we've got groups of viruses, and the relative size range of those viruses are listed, and they're all overlapping. So 15 to 20 nanometers, 20 to 25, 25 to 30 nanometers, all based on size. And really, we don't use electron microscopy much to diagnose or detect viruses anymore. So, but anyway, this group is called small round viruses. Often enteric viral diseases are multifactorial in nature. These viruses primarily affect younger aged birds. So we see a lot of enteric disease in younger birds. And of course, we are talking strictly viruses. There are some other infectious agents that can cause enteric disease in older birds. So these viruses will replicate in the epithelial cells and the distal parts of the villi. This is just a scanning electron micrograph of the intestinal villi. The viruses will cause these villi to shorten. And of course, when the surface area of the virus is reduced, you get less absorption of nutrients that are in the feed. We do have inflammatory cells that line these intestinal villi as well, and those become impaired. So the damage to the intestinal mucosa is really caused by a variety of factors, or causes a variety of consequences. First, because those villi are shortened and damaged, we get malabsorption or maldigestion, and this leads to an osmotic diarrhea. So we have increased water and electrolytes in the GI tract. We also have an increase in secondary bacterial and protozoal infections because of that damage. The avian GI tract has many areas that are part of the immune system. They're called Peyer's patches. We have a lot of lymphocytes in those areas. And so, of course, damage to that is going to cause some immune dysfunction. And then we have an inflammatory response. And so all of this contributes to additional damage. If you look down here on the right, this is a cross section of the GI tract where we have this condition that we call cystic enteropathy. And this is a condition where the crypts of Lieberkühn are damaged, and we have necrosis and the formation of these cysts. This is something that is commonly observed in a condition that we call runting and stenting syndrome. So again, a lot of our enteric diseases are named based on their clinical presentation. So we have malabsorption syndrome, we have runting and stenting syndrome, but the ability to identify the etiology in many of these cases can be quite difficult. What we do have for diagnostics, of course, collecting parts of the gastrointestinal tract for histopathology is very useful. It can rule out the contribution of bacteria and protozoa to particular enteritis. And then we also have a variety of molecular tests where we can detect the nucleic acid pretty much for all of the viruses that were listed on the usual suspects. Does that mean that those viruses are in fact causing the disease? Actually, it doesn't. And that makes diagnosis of enteritis very complicated. Because many of those viruses are also found in healthy birds. So it really takes a combination of a clinical assessment, histopathology, and then the diagnostic test to try to come up with a clinical diagnosis, but very difficult in general. Next, we have avian reoviruses. These are viruses that will cause viral arthritis and tenosynovitis in commercial birds. The term Rio was coined by Sabin early on, and this is relating to the role of reoviruses in humans, but these viruses were found in the respiratory enteric tracts and weren't at that time associated with any diseases. However, of course, that has changed, and we know that these viruses can cause a variety of diseases, and in poultry, that is musculoskeletal disease, viral arthritis, and tenosynovitis. We tend to see this condition in young meat-type chickens. The family is Reoviridae, and the genus is Orthoreovirus. These are non-enveloped, double-stranded, segmented RNA viruses that are transmitted horizontally and vertically. Let me see, I'm trying to get the chat box to come up because I don't know if there are any questions, but I don't see that. Hold on one second. Okay, it's kind of off to the side there. So here we have some tendon lesions where we've got tendonitis in this particular image here. This is the gastrocnemius tendon that has ruptured. It's just above the hock joint. And then we have some severe arthritis over here. Tendonitis here, these are the digital flexor tendons. This is a bundle of tendons that go from the hock and insert just above the foot. A lot of swelling. Here you might be able to appreciate there are some petechial hemorrhages, but this whole area is got a lot of inflammation and swelling. And then in severe cases, we do actually have a rupture of those tendons. And this tends to happen as birds get older, especially in our meat-type birds. You know, they're bred to gain weight fast, and when they get heavier, if they are infected with this virus, and if it happens to be arthrotropic, those tendons can rupture. And then we also see hydropericardium. And what we have here is the straw-colored fluid that appears in the pericardial sac surrounding the heart. So any questions on those? Again, I appear to be having trouble getting, there we go, the chat box up. Before we move on to control of diseases, any questions? Okay, so for control of poultry diseases, we have several strategies for those diseases that are reportable, such as high-path avian influenza and virulent Newcastle disease. In the United States, we eradicate these diseases by depopulation. This is something that that has the intent to stop the spread of this disease quickly. In commercial poultry premises, it's quite effective. We talked a little bit about the virulent Newcastle outbreaks in California that were in the heart of the metropolitan area of Los Angeles. That's much more difficult and involves a sector of poultry that is not it's not commercial, so very difficult sometimes in those situations to identify infected flocks because it's difficult to find them. You don't know where some of those birds or many of those birds are located. But in commercial premises, the depopulation works very well. And of course, this is all coordinated through APHIS at USDA and the state governments. You can see over here on the right, the Georgia Poultry Federation has a website called All In or All Gone. They put a lot of effort back in 2015 when we had an outbreak of avian influenza in the Midwest to put together this website that would provide useful information for the contract growers to help them understand how important some of the biosecurity practices are to limit the spread of disease and to give them a reliable resource for learning about avian influenza in that case. But certainly if we ever had to deal with virulent Newcastle nearby, that website would be updated. We also rely very heavily on biosecurity. And this biosecurity deals with controlling who goes onto a farm and who is allowed on the premises. This is control of feed truck drivers, technical service personnel, even personal family and friends of the contract growers, just trying to minimize the potential to bring anything infectious onto the farm. We've kind of had a lot of lessons learned for washing hands just during COVID, but this also applies to the biosecurity plans on the poultry farms, washing hands before and after contact with poultry, controlling tracking just by humans on shoes of infectious agent from house to house or even from house to another farm. So we wear disposable boot covers. We change clothes when we enter and exit poultry areas, and there's cleaning and disinfecting that goes on with pretty much everything on a particular farm. Certainly, growers are trained to look for signs of illness so that they can report any sick birds immediately. The sooner that somebody comes and assesses a potential disease situation in a flock and collects samples and confirms what is causing the disease, mitigation and control can be put into motion. And so all of this is something that the USDA spends a lot of time and efforts on trying to promote and train anyone that has birds. And then last, and this is what we'll talk a little bit more about, is vaccination. We do have a lot of vaccines that are available for use in our commercial poultry. These are vaccines that, depending on the age of the bird, how long the bird is generally being used, it will determine what type of vaccination program the birds get. So our egg type layers are longer lived birds. Those birds might be kept for over a year. So they tend to receive more vaccinations because there are more opportunities for exposure to infectious diseases during that time. And the same is true for broiler breeders. Those are the parent stock birds for the meat type birds, the broilers that we process for food consumption. Broilers are generally kept around for the shortest period of time, depending on the size of the bird that is required. Our fast food chains, they have a size range that they want. They might want a 3.5-pound bird. They might want a 4-pound bird, but generally those birds are around for about 4, maybe 5 weeks of age. And they receive far fewer vaccines. For vaccination, of course, we are talking about commercial food source. We rely heavily on herd immunity. This will actually lower the probability of an individual to become infected when part of an immune or less susceptible population is vaccinated. So our goal is to try to vaccinate as many birds in a given population at one time, so they get exposure at the same time to lower the probability of disease. And so in the poultry industry, that we rely very heavily on mass administration of vaccines. Benefits of vaccination. This is probably pretty obvious, but it bears acknowledging. We want to decrease the susceptibility to infection. So just by administering vaccines doesn't mean that we are eliminating the possibility of infection. There's really no such thing as sterilizing immunity. What we want to do is we want to limit the infection. We want to reduce clinical disease in the field, to minimize the risk of disease, and to reduce the shedding of the virus. Reducing the shedding means decreasing the amount of virus that an individual bird can disseminate. This also reduces the transmission. When we talk about vertical transmission, we're talking about a breeder bird that is infected with a virus, and then that virus getting transmitted through the egg. So the progeny chick would be infected for those viruses that can transmit vertically. That progeny chick can be infected with the virus that the breeder bird was infected with. And in those instances, those tend to be some of the worst cases of clinical disease, because we have a large percentage of birds shedding virus, progeny chicks hatching infected with that virus, and then they are capable of transmitting that virus horizontally to their hatchmates in the hatchery. So vaccination will reduce those events as well. We also use vaccines to control zoonotic disease, for example, salmonella. And the vaccines that are included in a vaccination program, as I alluded to earlier, really are selected based on the type of production, the lifespan of the bird, and biosecurity procedures in it, or policies in a given area. There are some diseases that are more local. We talked about infectious laryngotracheitis, and that is something that can be limited to a region of a state. And in that situation, birds in the whole state would not necessarily be vaccinated for ILT, but more likely just the birds in the region surrounding where we have active outbreaks. Of course, vaccines cost money, and so there's always a cost evaluation that's performed before a vaccine is incorporated into a program, and the cost benefit has to certainly exceed the potential for economic losses if the birds actually had the disease. So we have a variety of types of poultry vaccines. We have live vaccines, These are vaccines that are grown in tissue culture. Those might be tissue cultures that are derived from chicken embryos. And of course, we use specific pathogen-free or SPF embryos for all of our vaccine, poultry vaccine production. We have chicken embryo origin vaccines. We also have numerous recombinant vaccines. This is recombinant DNA vaccines. Most of them are developed on the herpes virus of Turkey, or HVT Merix platform, since just about every commercial bird in the United States is vaccinated for Merix anyway. This is a very useful backbone for our recombinant vaccines. So these HVT viruses have inserts of immunogenic properties from other viruses. So one example would be HVT-LT. So this HVT recombinant has several glycoproteins taken from ILT inserted into them. We also have HVT-IBD, so infectious bursal disease virus capsid protein is cloned into the HVT for that recombinant. And there are many others. And over the course of this past year, we actually had our first dual insert recombinant vaccines licensed for use. So the HVT has an insert for Newcastle disease and infectious bronchitis virus. And those are pretty much all administered in ovo in the United States. And I'll show you what that is in just a minute. Next, we have inactivated vaccines. So these are vaccines that are propagated in chicken embryos or tissue culture, and then the viruses themselves are killed with either formalin or beta-propiolactone, and they are adjuvanted with an adjuvant like aluminum hydroxide and mixed with an oil. And all of the inactivated vaccines are actually administered individually. So they get injected intramuscularly into each chicken. And so those vaccines are commonly used in our longer lived bird populations. So the next couple of slides I have that, and they demonstrate how we mass apply these vaccines. So I mentioned in ovo, and this is really an amazing technology that we have where we can go and in the hatchery inject embryos at 18 days of embryonation with vaccines that are safe to administer by an ovo. So all of the HVT recombinant vaccines are safe to administer in ovo. And this is a benefit for so many reasons, but the primary reason is that every single egg gets injected. And if we spray vaccinate, we can't guarantee that every single chicken would receive the same dose. So every egg gets the same dose, and it's administered in ovo. And this is just a little video here. This just shows the anatomy of a chicken embryo at 18 days of embryonation. And this is the injection from the Inovo machine. It has a cup that goes on top of the embryo, and then a needle comes through and deposits the vaccine in the amniotic sac. This is just a very basic in ovo injection machine. This is actually a model that we have in my lab for doing in ovo vaccine studies, but I'll show you in just a little while what the commercial machine looks like. And this particular piece of equipment will inject 54 embryos at one time. And then we have a scaled up version. And there's no advertising implied. It's just that the companies generally tend to make the higher quality videos for the commercial equipment. So this is what you would find in a commercial hatchery. These have several functions. They have an infrared detector that can identify viable eggs. And so prior to in ovo injection, you would want to remove any infertile eggs or any embryos that were dead. And so this particular system has that egg candler, and any of those eggs get removed prior to the injection. Not removing those embryos could cause some bacterial contamination. And so here, they're going through the detector and then they're getting injected. And the liquid that you see is actually a sanitizer. So the needle is sanitized before it injects every egg. So this process won't cause any bacterial contamination. And it also disinfects the shell of the egg. And then this is the age of between 18 and 18 and a half days of embryonation when the eggs are transferred from the setter into a hatching basket. And so this piece of equipment will do that transfer for you. So they come out of individual egg holders and they go into these hatch baskets and then back into the hatcher to hatch. And they'll hatch out at 21 days. Next, we have spray vaccination that can occur day of hatch in the hatchery. And here we have chicks that are in these chick baskets. 1 second. Here's the spray coming out of the nozzle. And here we have chicks in the chick baskets getting sprayed. So they get put on a conveyor belt. There's 100 chicks in each of those baskets. And vaccines that are administered by spray in the hatchery, they get sprayed out of these nozzles. And there are usually 4 nozzles that spray that basket of 100 chicks. The chicks will ingest the vaccine. They also inhale the aerosol, and then of course their faces and their eyes get sprayed. They get nasal administration, and then they can orally consume the vaccine through preening. And that's the reason that this particular vaccine is got the addition of a red dye. That's to increase the preening behavior of the chicks in that chick basket. So just through a combination of multiple routes of administration through the spray, they are vaccinated. And that occurs at day of hatch in the hatchery. Next, we also sometimes need to apply a field boost. So they get that first vaccine in the hatchery, and then usually somewhere between 14 and 18 days of age, they will get what we call a booster. This might be the same strain of the vaccine, or it might be a different strain of the same virus that's applied in the field. And this is done by spray. And so I'm just going to kind of take And again, no advertisement implied. We're just talking about. So here they have backpack sprayers. These are what you might use to blow leaf debris in a yard. Here they have the backpack sprayers that have the vaccine, and they walk through the chicken house, and they all the birds go to either side of the house and get sprayed with the vaccine. This is just them mixing up the vaccine in one of those backpack sprayers. And generally, they will reduce the lighting just to keep the birds from jumping around. This is usually done with two folks just walking down the middle of the house. Oops. Next, we can also administer vaccines in the drinking water. And they'll generally raise the drinking lines a couple hours prior to the administration of the vaccines so that the birds are ready to drink when the water lines are lowered. This is a centralized system that is, the vaccine tanks are located at one end of the house. Vaccine is mixed up in these large vats. And they'll add a blue dye so that they know when the vaccine has made it down to the other end of the house, they should see blue dye coming out of the water lines at the opposite end of the house. The dye and the vaccine go into these vats, and then the water lines are lowered, and the birds essentially drink the vaccine. So that concludes our lectures on viral diseases of poultry. Here I've just included a couple of resources for poultry health. The USDA APHIS website is very up to date on the presence of avian influenza and virulent Newcastle disease in the United States. The Georgia Poultry Federation also maintains a really good website with a lot of useful information for the public as well as for growers. And is a really active federation in the state where we have such a large poultry population. Let me go back down here. Okay, so sorry, I missed a couple of the questions, but I will